we get older, you know what they say, the eyes are the first to go. Whether it's near or far, no one likes to live with blurry vision. Here to clear up the fog with a quick and painless procedure, welcome ophthalmologist Dr. Colby Stewart. All right, Dr. Stewart, it just is one of those things that is kind of a fact of life. That the eyes are going to go at some point. But even before then, a lot of people have issues with their vision. A lot of people are not 20/15 or 20/20.
Well, that's right. I mean, there's a large percentage of the population that need glasses or contacts to help them see their best. So you mentioned it earlier in the show about legally blind. I mean, legally blind means that you can't see even when you have the glasses or the contacts on. So most people are not legally blind.
Yeah.
But they do need a pair of glasses or contacts. And now with where Lasik technology is right now, I mean, we're able to take the correction that they have in their glasses or in their contacts and lay it down directly on the surface of their cornea using a laser and have them see. I mean, this is something that is done and then you never look back. And they don't need. Some people think they need to come back in 10 years and have it done again, and it's not the case.
Well, I know. I wore glasses in 3rd grade, and then I wore contacts, and then dealing with allergies and stuff, I was constantly taking those contacts in and out a whole bit. So contacts and glasses can certainly take care of the issue, but if you want to get rid of the problem, LASIK can do that. I had LASIK done, and I can't tell you how many people say to me, oh, I just can't get with like a knife going in and cutting my eye. It's not that.
Well, the first thing I tell my patients is there's nothing they can do to mess this up. I mean, we've done, especially in the hands of someone who's very experienced, who've done 20, 30,000 procedures. I mean, you basically have seen everything. And people are very nervous, and they're really nervous about, are they going to make a mistake? Are they going to move? Are they going to cough? Or they don't want to see people coming at them with any knives or lasers or anything else. Really, the procedure takes 6 minutes to do both eyes, and we do both eyes at the same time. You know, we do the left eye and then the right eye, and the whole procedure takes about 6 minutes.
And literally, I saw a light and went, I felt absolutely nothing, and then the results are just right away.
Really, pretty much right away. I mean, I'll tell patients that when you sit up, you'll be able to see the clock from across the room. You'll be able to tell what time it is, but the numbers on the clock will be blurry, and that'll last for 3 or 4 hours. Their eyes will be a little irritated, but the next morning, that's where I'll tell them you'll have the wow factor. By tomorrow morning, you'll be able to drive yourself in. I'll take a look, make sure everything looks great, and then you're pretty much on the home stretch. And
then, of course, the other question people ask is it for people who can't see close up, or people who can't see far away, or both? And what if you have both issues?
It can be. Well, it can be people that get over 40. They need. If they're wearing contacts for distance, then they find they're needing reading glasses on top of those. So we can set people up in pretty much any way that they are with their contacts. If they're happy with monovision, one eye for distance, one eye for up close, we can set them up with LASIK. So, I mean, it's really come a long way.
Yeah. What if you have astigmatism?
Astigmatism, that's the other thing. I always, if I'm on a plane with somebody, someone will say, well, I wanted to have LASIK, but I can't because I have astigmatism. Well, we've really pretty much always been able to treat astigmatism ever since LASIK came out. So LASIK is an excellent way to fix and treat astigmatism.
Yeah, the bottom line is if people have any questions about their vision, to come into a professional so you can see what your options are, because sometimes we get misinformation or we start guessing. All right, there's some confusion, too, between cataract surgery and LASIK.
Right, and especially now because we're using lasers now to help us with cataract surgery as well. And this is relatively new. Within the last 1 or 2 years, we've been using laser. People are going to be hearing more about laser cataract surgery. But the difference really is where we're treating the eye. I mean, for LASIK, we're doing the treatment is on the surface of the cornea, what you would put the contact on. Cataract is the lens behind the pupil. When it gets hazy, you really don't have a choice. You have to do something. A pair of glasses or contact won't fix a cataract. So we can go in there and we use a laser now to help us remove the cataract. So both processes can use a laser, and but it's one is usually has to be done for someone to see better. The other, like LASIK, is cosmetic.
Okay, so for kids, LASIK is not approved for kids yet, but at what age can you get LASIK?
Usually 18 or older, and there's certain things that you don't want some, we don't want any of our patients to be pregnant, or nursing, and there's a certain range of people we can fix and we can treat, and there's certain people that we can't. And then if someone's so nearsighted that it's outside the range of LASIK, then we have something called the ICL, which you were talking about earlier.
Yeah.
It's a lens that we can put inside the eye like a contact, but stays in the eye forever if needed. But if we can always take it out and change it if we have to.
Yeah, and then of course I've heard people say, well, I've heard if I get LASIK right now because I can't see far away, that I'll have problems seeing close up sooner. But that can still be fixed.
And that's not true, actually. I mean, if you get LASIK when you're 35, when you're 42, you're going to need reading glasses. If you didn't have LASIK when you're 42, guess what? You're going to need reading glasses. You're going to need something to help you with the stuff up close. And that just comes with age. That's why you can buy a magnifying lens glasses at any of the department stores. You know?
Yeah, drugstore, wherever they're all over the
right,
place.
exactly.
Yeah, all right. Well, Dr. Stewart has a special offer for Great Day viewers. $1,000 off blade-free LASIK for the first 100 callers. You get $1,000 off. This includes the visit, the procedure, the post-operative care, and enhancements. To get in on this special, call 713-358-4340, 713-358-4340, and you can learn more about Dr. Stewart and LASIK at stewartlasik.com. I did it years ago, and like, fix it and forget about it, right?
That's right.
All right. Well.